Welcome back, everybody. Let's be honest, the COVID-19 pandemic affected us all in so many different ways. We went into lockdown hoping to not spread the dangerous respiratory illness, and the social changes caused an increase in anxiety and depression among our kids as well. Statistics on the number of children diagnosed with these conditions are alarming, and we want you to be aware. So, here with more on this topic and some help for parents is Dr. Erin Ruther. She's a clinical pediatric psychologist for Ochsner Children's Hospital. Thank you so much for being here.
Thank you for having me.
Yes, and I have so much I want to talk to you about. First, I want to really start with this statistic. 1 in 6 children between the ages of 0 to 8 years old in the United States are diagnosed with a mental, behavioral, or developmental disorder. I want to ask you this, doctor. How did the pandemic specifically affect this statistic right here?
Well, really, we know that even before the pandemic, we were seeing an increase in mental health problems in our children and in our adolescents. And we know that the pandemic really increased that quite a bit. A lot of times due to like the social isolation that we were seeing. Kids were just not able to be kids. They were not able to go through their normal activities. And that really has an impact on all of our mental health. We saw the statistics increase in our adults as well.
And it's so true, and especially parents, caregivers, really any adult watching this right now, think about it. Think how you were personally affected by the pandemic, by the lockdown. Hopefully you're mentally strong enough to have gotten through that, but let's be honest, our kids are learning about this, right, as they get older, so they don't have the same coping skills that maybe adults have. So it definitely makes sense. And I want to show you all actually some statistics when it comes to anxiety and depression. Like Doctor mentioned, it has increased. But as you alluded to, there are other things going on with our children besides just the pandemic. There were things happening. They're getting older.
Absolutely right. Our teens are trying to navigate adolescence. They're trying to understand and figure out who they are. The world has been changing all around us, right? So even before the pandemic, our kids are growing up in a different technological world than we are, and we're all trying to figure out how to navigate that together.
And it can cause anxiety and depression. You all saw those stats moments ago. You see they have increased. And it's so important, doctor will say this, I will say this, that you need to be aware of some of the common signs of depression and anxiety. We want to show you all. But doctor, I want to focus on those subtle cues, right? Talk to me a little bit more about those little things that we maybe don't necessarily think about when it comes to a warning sign.
Absolutely. So I like to tell parents, you know your child best, right? You know them better than I ever will, or better than anybody else ever will, right? So you're going to be able to pick up on those subtle changes better than anybody else would. We also know that it tends to vary across age ranges, right? So in our younger kids, we tend to see that kids are a little bit more clingy, right? They might have sleep problems, maybe when they used to go to sleep pretty easily and fall asleep within a couple minutes. Now they're staying awake, they're having trouble settling down. Maybe it's because something's on their mind or is stressing them out, or it's just hard for them to settle their little brains down. And then in our older kids, we tend to see a little bit more of that social withdrawal, right? So our kids who used to be outgoing or used to like to come home and tell us about their day, they're being a little bit more quiet. They're kind of sitting down and kind of hunkering down in their room by themselves, right?
And let's dissect that a little bit, because I have seen a couple of kids where lockdown happens, they go into this isolation, whether just in their room now, on their tablet, their phones, their screens, and they start to enjoy that. They start to feel like this is what I want it to be all the time. But many parents will tell you that it's important to be out there and social. How do we support kids who want to just be in their room at home, don't want to hang out with friends, because that's what makes them comfortable?
Right. Well, and one of the things we know is that being comfortable isn't always the best thing for us.
All right,
right?
all right.
So it takes a little bit of discomfort, right, to really learn how to navigate the world around us, right? These are skills, right? We need to practice these skills to get better at these skills. The other thing is, especially for our teenagers, one of the main tasks that they're doing is trying to figure out who they are, right? We learn just as much about ourselves from being around people who are like us as we do from being around people who are less like us, right? And we have to be able to be around all those people and navigate those conversations to be able to figure out that out, to be able to figure those things out about ourselves.
I completely agree, and we need to validate their feelings. Just because we think it's necessarily not the right thing doesn't mean it's not the right thing for them right now. And I'm so curious, because you're offering us some really great tips, but if we do seek the help of a professional, how do you all help differently than what we just mentioned to all the parents out there?
Right. Well, one of the things that we really like to do as psychologists or as psychotherapists is we really like to involve the family in that.
Okay.
But we like to dissect things down a little bit further, right? So instead of asking our children kind of how are you doing today, we want to break that down more, right? So we want to say, are you having any feelings of sadness, right? Or what has made you feel happy today? And really validate that idea that you don't have to have just one emotion. We want to avoid asking yes or no questions with how you're doing, right? That's an easy answer, but we're not really learning any information, right? So we want to be able to kind of ask those open-ended questions, right, that aren't necessarily pointed at, are you sad, but has anything made you feel sad lately, right?
Yeah.
And normalizing emotions, right? Every human experiences every emotion, and that's a good thing.
Come on, and it takes an outside perspective sometimes to really figure that all out. Dr. Ruther, oh my goodness, thank you so
Thank
much
you
for
so
being here. I really appreciate all the help you're giving these parents. And look, parents and caregivers out there, if you need help with this, do not hesitate to call any of these numbers on your screen right here. And to find out more information about Ochsner Hospital for Children or Ochsner Children's Hospital, new name, log on to ochsner.org. All right, stick with us, everybody. We'll be right back.